So I'm Randy Duguay, and I want to talk to you about eHealth. I've been involved with health tech for a long time, it's a term that needs a bit of new definition. eHealth typically meant electronic health, but I'd like to challenge that and say it's actually about innovation over time. And we should talk about enlightened health, engaged health, and empowerment. And what better place to start than talking about Leonardo da Vinci? He was a painter, sculptor, musician, architect, but he wasn't a physician, actually. So he didn't have access to cadavers, but he really had a lot of curiosity in bodies. And so he'd hire grave robbers to obtain cadavers so he could better understand and document the detail of the human body. From there, we could look at something else rather obvious. A great example of innovation happened in 1847 through the works of Ignaz Semmelweis, who worked in a ward that had 3 times the mortality of that of similar midwives' wards, and started publishing his findings. While the invention of the telescope made the stars more accessible to observation, the microscope opened the world for the smaller things, to look at living things and what they're formed of. The cell was first discovered by Robert Hooke in 1665, but it wasn't until 1838 that the cell research started to develop. A little closer to home, we could look at and understand the work of Dr. Banting and Best, who discovered insulin. When at one time diabetes was a feared disease that led to early death, and only treatment it was limited to strict diets. So through their methods, they would study new things. Another important innovation happened in 1895 through the research of German physicist Wilhelm Röntgen. Here in this photo, we have some researchers testing things. And again, they would have had some sense that this was a rather hazardous thing to do, but they did it anyways. Over to the idea of genetics. Here's a DNA strand, and it was first researched by an Augustinian friar, Gregor Johann Mendel, who first was studying plants in 1866. And it wasn't until after he died that the importance of this research was actually better understood around hereditary diseases. So then let's look a bit at engaged health. And in this case, we're looking at the advent of a modern day public health system. And it's something we're all proud of. It was first kind of discussed with Tommy Douglas, but it's a very complex system. And so that complexity actually needs to be addressed. And the first, what I call the Precomputeristic dynasty of EHR innovation, here we have the paper box and a Dewey Decimal System inspired concept where security would have been a padlock on a door. Moving forward, we could start to look at how that complexity was being addressed. And bit by bit, EHR innovation has developed similar to the banking system. But it also is a very complex kind of solution. And from there, once hospitals' health regions were finished, it was time then for doctors' offices to start to modernize. And now we've moved into this world of electronic medical record systems. They first started off as, frankly, sophisticated billing platforms and solutions, but quickly evolved to being a lot more sophisticated and focused on things like chronic disease and healthcare. As our communities became more networked, high-speed networks proliferated into the mainstream in the 1990s, and we now need to connect people through things like telehealth and telepsychology, telemedicine, teleradiology. Not that anybody noticed that the telephone was now soon to be an ejected common vernacular. Bringing us to the important topics of home care, collaborative care, remote patient monitoring, primary care networks, and with the continuing incline and well-documented aging of the baby boomers, technology is going to continue to play an important part in how we're serving people in their homes. As we move forward into tomorrow, or in the case of this fellow with the advent of Dr. Google, the age of empowered health is upon us. The millennials will never know a world that is not connected everywhere at all times and doesn't have a full slate of alternative truths to offer an answer me now level of patience. And if the promise of IBM's famous Dr. Watson, soon we're going to be in some very new spaces. Well, many of us seem to be opting to invest in social network trend, as this diagram would imply. Apparently, the more apps, the merrier. Where in the past we were well limited to one line to connect at one at a time, we can now be messaged and tagged and tapped like anywhere at any time. And now everything we create can have its own unique address, and we can create micro and nano circuits and sensors and controllers. We're now entering into this world called the Internet of Things. And to help take on those really challenging roles of keeping track of our pills and our sleep and our pulse and our breathing, big data, here we come. With empowered health, it's all about the numbers, right? Well, perhaps, but if anything, while we're all seeing a lot of people buying these amazing tracker and monitoring devices, many are not being used and they're being shelved, unfortunately, as we continue to revisit the value proposition of these solutions. But these solutions will improve and the incentives will improve too. It's hard to miss the exciting new world of wearable tech, and I know this picture is not exactly painting the picture of what we think people will really be doing just yet. It is very easy to see how these different parts of the puzzle will become ever smaller and virtually invisible and embedded into many of the regular everyday articles. And finally, we're now just entering into a new phase of advanced computer platforms. As we've really extended and we're continuing to grow the depth and dimension of our networks, the visual, audio, and sensory receptors will bring us to new worlds in our mind's eye. These kinds of solutions have incredible potential for areas of therapy, learning, simulation, and training. So I'm going to conclude to say we've come a long ways in our understanding and approach to health services delivery. And while there's many ongoing challenges we face in helping serve people's healthcare interests, we're continuing to innovate and will continue to make improvements over time. Thank you.